Hello and welcome to the Pace Hospitals podcast. Today, we are delving into an important yet often misunderstood topic that is ovarian cyst. These are common but sometimes concerning growths that can affect women of all ages, often without noticeable symptoms. Joining us today, Dr. Mugdha, an obstetrician, gynecologist, laparoscopic surgeon, and infertility consultant with extensive expertise in treating and managing ovarian cysts. In this episode, she will explore what are the ovarian cysts, why they form, their causes, symptoms, risk factors, and treatment options. Dr. Mugdha, thank you for joining us at Pace Hospitals, Hitech City. Let's start by understanding what is ovarian cyst.
What are first of all ovaries? Ovaries are two small organs situated just beside the uterus. The main job of ovaries is to release egg. Sometimes, due to multiple reasons, there might be an accumulation of fluid, blood, or any other solid substance leading to an enlargement of ovary from 2 to 3 centimeter ovary to even 10 to 15 centimeter at times. So this enlargement is called ovarian cyst. It forms like a bubble. So that bubble is called as ovarian cyst.
Dr. Mugdha, what are the types of ovarian cyst?
So, first of all, the very common cyst, that is functional cyst, which generally occurs in the young reproductive age group. Generally, when their ovaries are highly functional, when their hormones are functioning at a peak, at that time there can be a functional cyst like a follicular cyst or a corpus luteum cyst. Second one is benign ovarian tumors like serous cyst adenoma, mucinous cyst adenoma, or Brenner's tumor or dermoid cyst. Or the third one, which is neither a tumor nor a functional cyst, called as endometriotic cyst or chocolate cyst. It can be rather very painful.
So doctor, what are the causes of ovarian cyst?
Actually, frankly speaking, we don't know exact reason of why the ovarian cysts form, but we can assume it forms in many young women having irregular cycles, basically due to hormonal imbalance. And at times they just present with no symptoms, but they are incidentally detected. Or even it is very common in pregnancies as well, or patients with prior pelvic infections or any pelvic surgeries in them also, ovarian cysts can be commonly seen.
Could you explain what are the symptoms of ovarian cyst?
So mostly ovarian cysts are not symptomatic. Depending on the size of the cyst, they can be symptomatic as well as non-symptomatic. Generally, a smaller cyst are found incidentally during some other workups. They are seen to have ovarian cyst, or at times they can be presented with missed periods or irregular periods, or at times bloating sensation or dull aching pain in the abdomen. On the other hand, endometriotic cyst or chocolate cyst can be very painful. They can have painful menses, back pain, constipation, or pain while defecating, or even painful sex can be present in such patients. So that endometriotic cyst can be actually very painful. On the other hand, even a normal cyst can be presented as infertility. So even during the infertility workups, we find out patients to have cyst.
Dr. Mugdha, what are the complications of ovarian cyst?
So right now at present, the most leading complication of ovarian cyst is infertility. So generally patients with persistent irregular periods form cysts, and because of which they can be presented as infertility. So that's one of the most common cause of infertility is to roll out, first of all, cyst. Then second is there is a risk of torsion. So a long-standing cyst can also lead to torsion of the cyst, which can be presented as excruciating pain, even not relieved on any medicines or any pain relief. Or sometimes even a cyst can lead to rupture, because of which also they can be presented as acute pain in abdomen, which is not relieved after any medication. They can have some subdiaphragmatic pain or many other pains related to the rupture of the cyst. Or at times, a long-standing case which is not treated can even turn to a cancerous cyst. So we should definitely not ignore a cyst. Definitely everybody should go and follow up with their doctors to work up for the cyst and follow it accordingly to prevent any cancerous formation also.
So doctor, how to diagnose ovarian cyst?
So as said, ovarian cysts are not symptomatic. So generally they are incidentally found out when we are investigating for some other problems. But then just to looking when patient come with symptom of irregular periods or anything similar, we go for the basic most, that is ultrasound, abdomen pelvis, in which we can look for the cyst very clearly. In case if there is any doubt regarding anything like what is there in the cyst, like fluid filled or blood filled, or even when we want to look deeper into the cyst, looking at the size and the components of the cyst, we go for an MRI or CT scan. So these are the various ways in which we can find out ovarian cyst.
Dr. Mugdha, what are the treatment options available for ovarian cyst?
Generally, a smaller cyst of 3 to 4 centimeter, functional cyst specifically, can be just observed for a couple of months to see the reducing size, or it might go on its own as well. Or at times, hormonal suppressants might be given by your doctors. Or if the persistent cyst of more than 3 to 4 centimeter for 3 to 6 months, can be taken for surgeries. Cancerous cysts definitely require surgery along with adjuvant chemo or radiations, and then specifically endometriotic cyst or even a dermoid cyst requires surgery along with the medical management to suppress its occurrence again. But generally, ovarian cysts can definitely reoccur again because due to the hormonal imbalance which still continues, or if not taken proper care of hormones regulation, it can reoccur again.
Can you explain how to prevent ovarian cyst?
Since we have not yet found out the exact reason of ovarian cyst, but since we can even see it more commonly with people with irregular periods, so the most common cause we can assume to be a stress related or hormonal imbalance related factor. So the basic most thing that I would advise you all to do is, first of all, start on with the proper exercise regime. Can be a yoga, can be a walk, to prevent hormonal imbalance. Even breathing exercises with good yoga practice, meditation practice can lead to hormonal balance, because of which the occurrence of cyst can be reduced. Also, a proper diet with good amount of proteins and carbohydrates and can lead to good balance of hormones, because of which the occurrence of cyst can be reduced.
Is ovarian cyst dangerous?
So yes, depending on the type of cyst, it can be dangerous also. A cancerous cyst is definitely dangerous. A functional cyst, might not be dangerous, because at times, 90% of the times it goes on its own with the follow-up. But endometriotic cyst can be dangerous as well, because it might lead to, severe symptoms like pain and all. Or at times even a smaller cyst, a bigger cyst can lead to torsion or severe pain in abdomen because of rupture cyst. So at times it can be dangerous.
Are ovarian cysts common?
Yes, ovarian cysts are nowadays very common because of a lot of people going through hormonal imbalance. The main reason of it being the stress. So everybody at every age group is under stress. So because of which they are always under hormonal imbalance, which is the most common reason of having ovarian cysts.
So doctor, what size of ovarian cysts is normal?
So generally, a normal ovary in the adult reproductive age group is 4 into 3 into 2 centimeter, and in menopausal age group it is in the range of 2 into 1.5 into 0.5 centimeter. So a cyst of 3 to 4 centimeter can be still considered as normal, but it also depends on the type of cyst. Like a cancerous cyst of any size cannot be normal, or an endometriotic cyst also cannot be normal. Even a dermoid cyst cannot be normal. Only functional cyst we can consider as okay to observe for 3 to 4 centimeter cyst for a couple of months. Other than that, any cyst other than functional cyst cannot be considered as very normal cyst.
Dr. Mugdha, what size of ovarian cyst is dangerous?
So any cyst larger than 4 to 5 centimeter can be considered as dangerous. Even functional cysts larger than them can be considered dangerous, and a cyst like endometriotic or cancerous cyst of any size is dangerous. So it should not be ignored.
Can ovarian cyst cause infertility?
Yes, ovarian cyst can lead to infertility. The reason of it being hormonal imbalance, because of which there is ovarian cyst, and so a patient with infertility on the workup can found to have ovarian cyst.
Can ovarian cysts cause cancer?
Not all cysts can lead to cancers. But a cyst can be cancerous on its own as well. So definitely depending on the age group and depending on what are the symptoms and other things related. So yes, ovarian cyst can be cancerous.
Can you explain what happens when an ovarian cyst ruptures?
Ruptured ovarian cyst might resemble effects of acute abdomen, that is severe pain in abdomen, with pain even in the chest pain or back pain, with or without periods, not associated actually with the period, or sudden breathlessness, loss of consciousness can be some of the symptoms of ruptured ovarian cyst.
So doctor, can ovarian cysts cause irregular periods?
We cannot actually predict what ovarian cyst can lead to irregular periods, or because of irregular periods is ovarian cyst. So yes, ovarian cyst can lead to irregular periods.
Do ovarian cysts go away after menopause?
After menopause, there is a sudden decline in the ovarian hormones, basically FSH, LH, estrogens, progesterones, all this. So because of this, the size of the ovaries shrink drastically, and yes, after menopause, most of the ovarian related problems or even uterus related problems go. But if still the ovarian cyst or even any uterine related problem are persistent after menopause, definitely they should be worked.
Dr. Mugdha, one final question. Are ovarian cysts the same as fibroids?
So ovarian cyst is not same as fibroids. Fibroids is a tumor in the uterus. It can be inside the uterus, outside the uterus, or in the muscle of uterus. But cyst is something which occurs in the ovaries. Ovaries are the organs which are beside the uterus and not in the uterus. So ovarian cyst and fibroids are two different things.
Thank you, Dr. Mugdha, for sharing crucial information regarding ovarian cysts to our listeners. If any of you have any further questions regarding ovarian cysts, please don't hesitate to consult a gynecologist. Remember, awareness and timely medical guidance are key to managing your health effectively. Thank you for joining. We will be back soon with another episode on Pace Hospital's podcast. Until next time, take care, be well, and be compassionate. Thank you.